Welcome back at 7:14. This week is National Women's Health Week, a week dedicated to encouraging women of all ages to care for their physical, mental, social, and emotional health. With us this morning is Dr. Carrere with some ways women can start taking those steps for a healthier future right now. Dr. Carrere, good morning, and thank you so much for being with us.
Thank you for having me. Good morning.
So obviously women can do a lot of things to focus in on their health, but let's kind of backtrack a little bit and first talk about some of the more common conditions that women typically deal with that, you know, if they're prioritizing their health, they might spot sooner. And that's, I know time is of the essence always.
Of course. So I always want to mention vascular diseases, so heart attack and stroke, and these are under-recognized in women often and really need to be a priority and screening for risk factors such as high blood pressure, cholesterol, diabetes, and family risk factors. So common in both men and women, but also very common in women. Cancers, specific cancers to women, breast, uterine, cervical cancer, all, you know, we can screen for, but then colon cancer, skin cancer is very common. Symptoms and health is really important, and often, you know, women just sort of assume that their symptoms are natural and that they're expected, but we can also do a lot to help with these symptoms typically. And then mental health. Mental health is something that everyone is struggling with these days after the pandemic and just with the stress of life. And so really making sure that you're addressing your mental health are really common conditions in women that should be addressed.
And Dr. Carrere, how can women go about prioritizing their health right now? What are some steps they can take starting today?
Of course, yes, that's so important. So if you feel like you have an issue or or a concern, contact your physician and make sure you're heard. You know, repeat yourself if you feel like something didn't get translated well, and really advocate for yourself. And then go to your doctor regularly. Get your preventative screenings, pap smears, mammograms, colonoscopies, blood work for cholesterol, blood pressure check regularly. Make sure you're vaccinated for anything you can be. These are really important things you can do to prioritize your health.
And another really important thing women should consider it and keep in mind is their nutrition and health. I know that's one that sometimes goes by the wayside, but really, really important overall.
Of course, health starts at home. We need to be taking care of our health, setting good boundaries with work-life balance, make sure your diet stays healthy, getting exercise for mental health as much as for anything else, and then making sure you feel like you have a good community and good support. So health does start at home.
Well, Dr. Carrere, hopefully these are some just good reminders for women as we all move through this week. I know life's so busy, but you cannot put your health on the back burner. Thank you so much for your time this morning.
Thank you so much. Have a good day.